Guest this morning from San Juan Health Partners Pediatrics. Dr. Brittnay Kimbell is here with me this morning. Dr. Kimbell, good morning. Welcome to KSJE.
Good morning. Good morning. Thank you for having me.
You bet. Nice to have you here. And welcome to Farmington, because you were telling me you're here about 6 months or so, right?
Yeah, just got here in January, and that's when I started at San Juan Health Partners as well.
Okay, very good. Well, I know our topic today is children's oral health, and that is something that you talk to your patients and their families a lot about, right? And it's something that everyone should be aware of, because you were telling me that sometimes children or young children don't get in to see a dentist for maybe the first few years of their life, but you see them right away.
Yeah, and so we have a great opportunity to be able to do some really good interventions before they actually see a dentist. One of the main things that we get to focus on is talking to families about how to take care of their teeth. Right? And that includes a lot of things. We always want to encourage our families to establish care with the dentist by the first year of life. That's our goal.
Mm-hmm.
But during that time, other things that we can do is focus on their diet. When we're talking about our babies, making sure that we're not propping up bottles, exposing their mouth to a lot more milk throughout the day. When we're talking about our young kids, we're thinking about things like healthy vegetables and fruits and cheese, things like that for their snacks instead of our sugary things. And then also trying to avoid a lot of sugary beverages in between meals too.
Right. That's a big list, I think.
Oh, yeah.
And probably a tough sell sometimes for
A lot of times.
kids and maybe parents too, right?
Yeah.
And so let me go back a little bit about those very early young children and babies, and how do you kind of talk about oral health and teeth if they don't have teeth yet?
Yeah, that's a great question, right? I always want to focus on building healthy habits. And what we try to do is encourage them to, after meals or at least once a day, go ahead and wipe their gums as a sort of a practice of brushing their teeth. That is a way to help clear the bacteria that could be growing in their mouth already and get them set up for a healthier mouth.
Got you. And a lot of this is habit forming too, right? We want to form these good, positive habits, both with brushing your teeth and the oral health care and things like that, but also probably healthy eating habits too.
Definitely. So it's a benefit in a lot of different ways. So I like to take the opportunity whenever we can.
Right. And you're able to help these children at an earlier age, again, because sometimes dentists don't see them until they're maybe a few years older.
Definitely. So a lot of times people won't even talk about brushing baby teeth. And it's really important. They're there. And baby teeth are important because how we take care of our baby teeth reflects how our permanent teeth will come in and how we can take care of those too. So when you just have your first baby tooth, it's okay to start brushing it.
Okay,
So,
got it. Because some people might say, well, they're just baby teeth. They're going to fall out and they're going to get their permanent teeth. So let's worry about the permanent teeth, which is important. But those habits are important too, to brush and care for those baby teeth. And I suppose every patient is different. And so maybe if their teeth are a bit maybe weaker or more susceptible to bacteria or what have you, that would be something you could tell by how their teeth are doing, the baby teeth are doing.
Oh, yeah, definitely. So the one thing that we're looking for is what we say is like early signs of cavities. And they look like white spots on the teeth. And normally they're right around the gum line. That's the most common place. And that's the earliest stages. And those things can progress to what looks like brown or black spots in general. And that's what we want to prevent. So we do focus on trying to get fluoride varnish on their teeth. Fluoride itself has a lot of great benefits. So what it will do is it helps to build up the enamel, that hard layer on the top of the teeth, and kind of protects it against the acids that we expose it to every single day. And in general, fights the bacteria too. So
And so these treatments are maybe as important or more important in younger people than they would be maybe in older people to build up that enamel at an earlier age? Is that kind of what you're seeing?
I would say that it's equally as important.
Okay.
I think it's important for all of us to take care of our teeth the same way. So you can also take this as a family approach, and we're all doing these things to make the best impact on our teeth.
Right, very true. And these treatments, though, the varnish treatment that you mentioned, are things that you can do.
Yes.
A dentist can do it, but you can do it as well, maybe at a younger age.
Exactly. So we start with the first tooth. That's when we can start doing it. On average, that happens around 6 months of age. As health providers, we can do it every 6 months. and it is covered by your insurance as well. So we're happy to do that as long as you would like us to, and until you get a chance to establish your care with a dental provider.
Right. Very good. Is there any outstanding question that you hear a lot from new parents about the oral health of their kids? Is there one that comes to the top more often than not?
I think that most people are like, nobody even tells me what to do with their teeth. So just in general.
Information.
Yeah, just in general. They're just like, well, am I supposed to be brushing it? I'm scared that the fluoride in the toothpaste is not safe. Some people told me not to do it, not to worry about it. But I think it's not a part of the conversation all the time. And I think that's a great opportunity for us to step in and do that.
Right. Very true. That makes sense. Talk to me about toothpaste and the amount of toothpaste, I guess, to use, right? Because if you only got one tooth, you don't need a whole brush full of toothpaste, I would assume.
Yes, you are totally right. So any kid that is less than 3 years old, they need about the size of a grain of rice. And it ends up being like a smear on the
Yeah,
toothbrush.
like a little, right.
Yeah, like
Okay.
really anything, right?
But that's enough to do the job.
It is. It is effective. And then once they're over 3 years old, it's about the size of a pea.
Okay.
So doing that, brushing their teeth twice a day for 2 minutes is the recommendation.
And that I know, even from my visits to the dentist, is what we do even when we're older, right? So that's a habit that gets started early, hopefully, and sticks with those children for years and decades.
Yeah, that is the
Hopefully.
hope. That's the hope, and hopefully they enjoy it. We also encourage families to do something fun while they're brushing their teeth, because a lot of times they get bored and they're like, I don't want to do this. So we encourage things like watching their favorite show, singing their favorite song. They can even sing their ABCs. And by the time they're done with their ABCs, then they've gotten through all their teeth.
Right.
That type of thing.
There you go. See, as a radio person who thinks and talks in 30-second increments, I know how long 2 minutes is, and it can sometimes feel like a long time when you're just doing, something like brushing your teeth for a while. So that does make sense. Let me back up again a little bit and ask you about the teething time for infants, and that I know, well, I don't know personally, but I've heard can be a rough time for children, babies, and their parents, right? Because things are happening and there's movement and growth, and so that can be a painful time, I guess, for the infants, right?
Oh yeah, big time. So before those teeth are coming in, they're
Yeah.
going to be drooling a lot more, and that's a normal thing. I know a lot of parents get concerned about, oh my gosh, my baby's drooling. Is there something wrong? No, this is normal. And a lot of times they're like, well, what is that coming from? And that's really just the stimulation of them putting their hands in their mouth a lot more. That creates a lot more saliva, and they're putting their hands in their mouth a lot more because they're trying to chew on something because they're uncomfortable with that teething process.
Got it. Very good, but normal.
Yes, all normal.
Okay.
All normal.
But of course, parents can always ask their pediatrician, and they can get that reinforcement or get some other advice about what's going on with their child.
Exactly. And
Right.
a lot of times we can do an exam on the mouth itself, and we can kind of identify if there are any teeth buds that are present so that we can give them a better idea if we see something happening.
Right. Very true. Very true. My guest this morning, Dr. Brittnay Kimbell, is with me this morning. She is the newest pediatrician at San Juan Health Partners Pediatrics. We're talking about children's oral health, and that's just one area that I know you deal with when kids come to see you. What are some of the other things that you're doing this time of year? I guess for school-age kids, it's kind of exams and physicals and things like that, I guess, to get ready for school in the fall. That's coming up.
Definitely. So a lot of times we're trying to catch everybody up on getting those well child checks in because they have a little bit more time and they're not going to miss school to do it. Earlier this year, we did do some sports physicals at the high school, which was an amazing opportunity for us, and we were happy to do it, and we plan on doing it next year as well. But we are also open to do those sports physicals at our office.
Very good. And the office is located near the hospital. I'm putting you on the spot.
I was like, oh my goodness. It is. It's right at on Schwartz and Animas.
Right, Schwartz and Animas.
Yes.
Got it. Can't miss it.
Yes.
If you're in that neighborhood, that's for sure. So there you go. What are some of the other things that we want to let folks know about this morning? In addition to oral health, is there more about oral health that I've been asking you about that I've missed?
No, I think
covering it?
Yeah, I think we're covering a good amount of it.
All right, very good. But what about some other things during the summertime? I know, kids out in the sun, sunscreen, always good advice no matter how old you are, I would think. And especially for young children, maybe their skin is very sensitive to sun and the rays from the sun.
Definitely. So, being outside the hottest time during the day and where you can get the most damage to your skin is in between about 10 a.m. to about 2 p.m. So, being really aware of that, making sure we're staying hydrated as well. But to answer your question about sunscreen, in general, we recommend no sunscreen before 6 months of age.
Okay.
Mainly because we're worried about it being soaked into the skin for babies. So for babies, what we do for sun protection is making sure that they're nice and covered. We want them to have a cute little hat on and some long sleeves if we can. On those areas that we can't cover, things like their face, their hands, and their feet, it's okay to do a mineral-based sunscreen, things like a zinc oxide-based.
That's the better choice.
It is.
The best choice
Yes.
to use. Got it. And then after 6 months, they're okay for other types of sunscreen then that we might use on a child or an adult?
Yeah,
I
they
guess-
are. They are. And the important thing that I think gets lost sometimes is making sure you reapply. That's a big thing.
Right.
And it'll even tell you on the bottle, in general, we should be reapplying every 2 hours.
Got it. And if they're in the water, swimming, things like that, that may also affect that schedule.
It does.
Too.
A lot of times the sunscreens are waterproof, and so you can look on the actual bottle to make sure that it is. But in general, they should be lasting about 2 hours.
Okay, good to know. Very good. Other things this summer, over the summertime, that folks need to be concerned about? I know heat is another issue as well, right? And we hear about kids that are maybe just getting left out, maybe, or they're hot, or they get hot, and they can suffer some of those other health problems too, heat stroke and heat exhaustion, things like that. Affects children as well as adults.
It does. It does. And I think the main thing is definitely thinking about that timing that you're going to be outside. So if you can be earlier or later during that time, that'll help. Making sure that we have hats to help keep us cool. Everybody having water around them as well. And just kind of keeping an eye on our younger children too. Because a lot of times they won't tell you that, oh, I'm really hot or I'm really tired. And making sure that if they're slowing down, we're making them take a break.
Right. That's important. Hard to think that kids ever slow down, but sometimes they do. And if it's the weather, then that could be an issue if you don't catch it or don't pay attention to
It can be.
what's going on.
It can
so
be.
That's
Yeah.
important as well. Very good. Other things, just final thoughts before we go this morning, or what to share with the audience?
The only other thing I would say is take advantage of the summertime and making sure that we're staying active, right? That's going to be beneficial for a lot of different things. So trying to be active at least an hour every day would be great for everybody.
Okay, very good. Do you have any advice about how to get kids away from screens
Oh,
and
man.
things like that?
I would challenge them to try and find something that they've never done before.
Okay,
Every single day. We've got the time.
right.
So, and we live in a great place where there's a lot of outdoor activities too.
That's for sure.
So, and maybe this might be a little bit of a stretch, but it's also possible for you to walk outside and still have your screen. So you can do both at the same time.
What?
But I really think it's a good idea to get your body moving.
I think that's good advice. Oh, not just in the summer. I think probably year round.
It is,
is good
yeah.
advice as well. But you're right. I think there are some. I have some friends who are. They're kind of into Pokemon. I think they would be doing that outside. So that would make sense to me that they would be able to do that. And so there's probably a lot of other games that offer that opportunity to wander around and get outside.
Yeah,
So
I would
very
say so.
good advice. Dr. Kimbell, it's a pleasure talking with you and meeting you today. Thank you very much for coming in and sharing your expertise with us.
Yeah, no problem. Happy to come. Thank you for your time.
You're very welcome. Nice to see you.